Hello, my name is Brandy Likens. I am Dr. Kager's physician assistant. This educational video is for your upcoming lumbar laminectomy. On the day of your procedure, you will arrive at either the Neurospine Center or at Lancashire General Hospital, wherever you are scheduled to be done. At either place, you will check in and then you will proceed to the preoperative waiting area. Once you are checked in, you will see Dr. Kager, who will answer any questions that you have. You will also see anesthesia. If you are being done at Lancashire General Hospital, we run 2 rooms there. So you will have to be there before the person in front of you goes back for their procedure. Due to this, you may have a prolonged waiting time from the time you arrive to the time of your procedure. When it's time for your procedure, you will be taken back to the OR suite. Once you're there, you will see a whole bunch of people you will probably never recognize. There will be the anesthesiologist, the nurse anesthetist, 1 or 2 nurses, the surgical technician, as well as Dr. Kager and probably the advanced practitioner assisting in surgery. You will be put to sleep while on the stretcher, and then the OR staff will roll you onto your belly on the table and prep you for surgery. Once you are prepped for surgery, Dr. Kager will make an incision over the area that we will be working. Once he's done that, he will dissect down till we get to this level. These are the spinous processes. If you feel along your back, those bumps that you feel, this is them. He will then take an x-ray verifying what level of the lumbar spine you are at to be sure that we are at the correct level for your surgery. He will then take a portion of these bones off to provide a window to which to work. These here are the holes where the nerves come through. In order to get to this, he must create a window here. Once he has done that, he cleans out anything that is blocking that nerve, whether it is disc, ligament, bone, or epidural fat. Anything that's in that hole will come out to free up the nerve to take away the pressure. Once he is happy that everything has been freed up, he will flush the entire area out and closure begins. Your incision will be closed with dissolvable sutures, both in the deep layers and right underneath the skin. The incision is then reinforced with a dissolvable glue. It will flake off as it is washed. If you are done at the Neurospine Center, that dressing will need to be changed after about 48 hours as long as it is clean and dry. If you are done at the hospital, the dressing that will be placed needs to be kept in place until your first postoperative visit. If for some reason that dressing should become saturated or wet, it should be removed and gauze and tape used to cover the incision. Once you're able to get your incision wet, you will keep it clean with warm water and soap. You will not scrub or rub the incision for any reason. You may use a very sudsy washcloth, for example, pat along the incision and let water run over top of it to keep it clean. The incision should then be patted dry. Absolutely no ointments, oils, lotions, or butters should be used on the incision, at least for the first month or so. When we see you back at your 1-month postoperative visit, at that point you will be able to begin to use more things on the incision to help with dryness and things like that, should you be experiencing it. Following your lumbar laminectomy, you will have restrictions for approximately the first month. This will include no bending at the waist, which is anything that would have you round your back while moving forward, twisting, lifting anything more than 10 pounds, pushing, pulling, or overhead work. This will be able to be relaxed once you start physical therapy at the 1-month point. There will be other limitations following surgery that should be kept in mind. You should be up and walking approximately every 30 minutes or so, just short distances like getting water or going to the bathroom. You should have 4 prolonged walks a day. The length of the walk should be slowly extended as tolerated. Please remember, however far you're out, you actually have to come back, so you don't want to overdo it. Walking is very good for recovery. It helps you breathe deeper, helps your bowels move, helps you sleep better, and also helps prevent blood clots, which could go to your lungs with really disastrous effects. You may begin driving after your first postoperative appointment, providing you are off all narcotics and muscle relaxants. Sexual activity may begin when you and your partner are comfortable with this. Should you begin to experience pain during sexual activity, it may mean that your body is not quite ready yet and you would need to stop. We here at Lancaster Neuroscience and Spine Associates understand that undergoing surgery can be extremely stressful and anxiety-provoking. We sincerely hope that watching this video helped answer any questions surrounding surgery. For any additional information that you would like to review regarding your diagnosis or procedure, please see the links below. And never hesitate to call the office with any questions or concerns.